at this time as you enter into this space. So we want to welcome you all. I know a lot of you are still connecting, so please take the time that's needed. But once you are able to fully connect, please mute your phone so that we can go through this process. So we're going to give it a couple of moments as people come in, but we want to welcome you to this space and thank you for joining us. So welcome, welcome, welcome. We will begin in 1 minute. Thank you so much. Welcome, welcome, welcome. So good afternoon, everyone. We want to encourage everyone as they're entering into the space to please put your phones on mute so that we can be able to capture the full experience without interruption. So I am Dr. Kelechi C. Fluid. I am honored to work at the Howard University, and I serve in the capacity of Outreach Director at the Howard University Counseling Service. And today we will be having discussion and dialogue around grief and loss, particularly in the COVID-19 pandemic, but also noting that grief and loss is a part of life, and really just taking in the full experience that comes along with it and helping people to learn how to cope with grief and loss in this global pandemic. So even as we allow other people to enter into this space, the first thing that I think is really appropriate for us to do during this time is to offer in a moment of silence. And so I would like to offer a moment of silence at this time for those who you are gathering in this space to honor, as well as for the almost 230,000 lives that we have lost in the United States due to the global pandemic, and the almost 1.4 million lives we've lost globally due to the pandemic COVID-19. So at this time, I want to honor them in this space with a moment of silence. So I ask that you all take a moment. Thank you so much for that. So welcome everyone. Again, if you're just joining us, I'm Dr. Kelechi C. Fluid. I am the university, a member of the University Counseling Service at Howard University. At this time, I would like to go straight into introducing our panelists, our wonderful panelists. First, we have Ms. Teresa Doniger. She is a sole proprietor of Cure Counseling LLC, a private psychotherapy practice based in the DC metropolitan area. She helps young professionals who seek support, assistance, and guidance with many of life's most important events, like starting one's career, developing healthy and meaningful relationships, as well as learning to heal from and manage experiences such as the loss or death of a loved one and the other traumatic experiences that come along with life. Before becoming a psychotherapist, Ms. Doniger worked with various social services organizations in the DC Latino community, as well as other communities in the DC metropolitan area. So we want to thank Ms. Teresa Doniger for being a member of the panel today. Next, we have Dr. Jade Saunders. She's a postdoctoral associate and has a diverse and culturally rich clinical experiences that have shaped her interest. Her training has included college counseling, outpatient and inpatient, hospital treatment, and child community mental health care. In addition to individual psychotherapy, she also enjoys providing group psychotherapy or group therapy, family therapy, and couples therapy. Dr. Saunders uses psychodynamic therapy to help clients understand how their environment and their past experience have shaped their current behaviors. She also enjoys integrating other treatments such as cognitive behavioral techniques and mindfulness. Her passions include helping clients through difficult transitions, processing trauma, and exploring family dynamics. So please help me welcome Dr. Saunders. Last but not least, Dr. Shareefah Al'Uqdah has a longstanding commitment to providing or improving the lives of minorities through mental health initiatives. At North Carolina Central University, she founded her passion for psychology, earned a bachelor's and master's degree, and ultimately she earned a PhD in counseling psychology at Howard University. She has published research which examines issues that impact urban families, urban schools, and African-American Muslims. She's received over $2 million in grant funding to help decrease mental health disparities within underserved community. And outside of academia, Dr. Shareefah serves as a founder and chief executive officer of Your Neighborhood Clinic, a non-for-profit that provides low-cost and insurance-based mental health services to the DMV community. So I want to welcome Dr. Shareefah Al'Uqdah. Thank you so much. And so at this time, I think it's important as we frame our discussion, there was something that stuck out to me that I want to read at this time. It says the COVID-19 pandemic is an epidemiological crisis, but also a psychological one. While the situation provokes anxiety, stress, and sadness, it also is, which we're gathered here for today, a collective time of sorrow. It's important for us to note, as we're in the middle of the pandemic, the collective grief that is associated with it. So not only grief, but individual losses, including death and illnesses to the novel virus, loss of employment as a result of economic upheaval, as well as people losing things that may not feel as concrete, like the loss or their sense of predictability, control, justice, and the belief that we can protect our children or elderly loved ones. So grief and loss is kind of enmeshed in both of them. So it's not just grief, but also loss. So I want to kind of toss out to the panelists, where do you find yourself as you provide healing in this space? As you are an individual or a clinician that is helping people along the grief and loss process, in the middle of this pandemic, what are you seeing? What are some of the things that are coming up? What are some people dealing with? What are some of the experiences within the community? And anyone can answer.
So I've been, seeing, hi everybody, I'm Dr. Al'Uqdah. So I've been seeing everything that you sort of addressed, Dr. Fluid. So one, not real, but mourning regarding life, right? Whether it's been the loss of life due to COVID or just the natural progressions of people's lives ending, people's parents passing, grandparents, people's loss of lives due to other tragic misfortunes during this time. And people really dealing with the loss of what they understood as their normal. And so both of those losses have caused people to experience immense feelings of sadness, and a lot of anxiety around meaning, trying to make everything that they're going through make meaning and make sense. And then I've also been experiencing, how do I, as a mental health provider, manage all of those things while simultaneously trying to be a helper to my clientele as well.
So not only trying to help people through their own losses, but being mindful of where you may fall in that. Any other thoughts about what we're seeing as people are coming to us for support with grief and loss? What are some of the things that we're seeing?
Hi everyone, I'm Dr. Saunders. So I was pretty much, so at the time I was doing an internship at actually a university. And so a lot of my students, they had lost their emotional space. Like during the quarantine, they were kicked out of their dorms. And so pretty much what I found myself was, even if we may not be as productive as we were in our clinical work, I was there to provide emotional space for them. Like their parents might have been fighting, or their siblings might have been fighting, or, like, oh, my parents are sick, I have to take care of them, just pretty much working with them, pretty much where they were and helping them with their frustrations and kind of like you were saying, Dr. Floyd, like going through my own stuff. Like I'm an intern, I'm still learning, crisis management, trying to figure out, okay, get my needs met so that I can still be there for my own patients. So I think that was like a huge balance for, a lot of people in the mental health field as well.
How would you say grieving has impacted, or how would you say grieving has been impacted by COVID-19? What are you seeing or what are you hearing? Because naturally, communities, I know one of the things that I'm thinking about is the gathering, right? And the ability to mourn in communal spaces, and that being impacted because even though we are still experiencing grief and loss, we're not able to mourn these deaths in the way that we used to pre-March. And so that's one of the things that's coming out for me. Are you all seeing anything else about how people are able to grieve or how grief has been impacted in the midst of COVID?
Yes, people are really making sort of life and death decisions regarding traveling very early on. So people were very hesitant about, should I go and be with my grandmother who may be terminally ill? What does visitation at the hospital look like? Will I be allowed to travel? And then what will be the implications of that if I have to quarantine when I return home? So a lot of people have had to, some of the rituals that we've had around grief, around loss, has had to change tremendously because of some of the travel restrictions and the realness of COVID being here. And so I've had to help a lot of friends more so than family members navigate their feelings of guilt and despair around not being able to sort of be a support or to attend their father's funeral in the way that they may have wanted to attend because of COVID. And that has been something that has been really, I think, detrimental. I think that I have also seen people, though, begin new habits and new rituals in terms of grieving too. That has also been helpful, so family members where they normally wouldn't engage so much virtually or normally wouldn't engage so much in group and family chat, have seen an upswing of that after the loss of a family member or a friend. So there's been a lot more, I think, healthy and helpful use of technology than what was previous before COVID.
You can hear me, right? Okay. So this is Teresa Doniger. And one thing I just wanted to add is that, of course, millions of people have been grieving already. So in my work in particular, I haven't had very many clients who have been personally impacted by the death of a loved one due to COVID-19. Not so far, thankfully. But because I am a grief counselor, that's what I do 85 to 90% of the time when I'm working with clients. My clients already were grieving. And so I think that, just sort of recognizing how there's so many layers for many people now that we've been in this pandemic.
Yeah.
And, you already are grieving because your mother died, 10 months ago. And, perhaps other people are also dying, in your close family or extended family. And so what I see is that these layers are profound and profoundly challenging and burdensome, I would say. But the flip side, while I was listening to Dr. Al'Uqdah, close, hopefully. I was thinking about, what I also see with my clients is because, like, I have a number of clients that have children, because they have to figure that out. They have to put on the teacher hat as well as now they're the full-time chef, preparing 3 meals a day and all of that. I do think that in some ways, for some of my clients who already were grieving, that those requirements for them to show up and to be relatively high functioning, I actually think that that's a positive. Even though it's in the midst of all this, really challenging, difficult stuff.
Let me note a comment from the chat. Someone said, I'm seeing the level of grief is so much more intense and people are feeling torn that they cannot honor their loved one's wishes. It feels very heavy. And let me acknowledge that yes, that is a lot of the sentiment. And I think it goes back to what Dr. Al'Uqdah was saying. I think Ms. Doniger said something that stuck out for me, which is the reminder that it's not just grief that's happening, right? Life is happening in the midst of it, and so much more is happening that doesn't even allow us. Sometimes it feels like we're not allowed the space to be able to grieve because we're responsible for so many other things. And that grief process is so much encompassing that, to her point, her clients may not have been grieving someone who passed through COVID, but because she's a grief counselor, it's a life cycle, right? And so what does that look like as we process deaths that may not be due to COVID or that may be due to COVID in the midst of COVID? So just something for us to continue to consider. As we transition a little bit, Dr. Saunders talked about this a little bit. She said last year she was on internship. And so she is a member of the class of 2020. And if we know what that sounds like, right, we know that this class transitioned from brick and mortar to virtual. And now, if you're a freshman at Howard or Bison in the space, are now learning in a virtual environment. So I want her to touch a little bit about what that loss experience was for her.
Sure. So like Dr. Floyd was saying, I am part of the class of 2020. And so, of course, before that in the fall, I'm like tied up into, trying to do my dissertation and trying to plan. I'm a first generation college student. And so this was supposed to be a big part of, everyone's life. And so not only am I mourning like the loss of my graduation, but so is my parents, my friends, my family. And so just trying to manage that while being a therapist and while being there for my other cohort members who are also, mourning. And so just knowing, and then the guilt and the shame of, well, I have a roof over my head. I didn't lose anyone, do I have the right to kind of grieve in, this loss? And so just the complicated of all that factors, really put things in perspective.
And I think, and thank you for sharing. And I think that you represent a lot of people that may be in this space, whether or not they may be class of 2020 or they may have family members, right? One thing that stuck out to me that she said was being a first generation college student and having all of these plans, right? And so when we talk about grief and loss, it's important for us to know the loss piece also, that it could be the loss of a milestone. That experience that we have been waiting for, that family reunion that only comes around once every 15 years, that connection. Someone said in the chat, one of the factors I'm seeing in my practice there is the loss of human touch and connection. People are grieving and navigating COVID with the absence of this form of support, and that has been felt. And so just knowing that one of the things that COVID does is restrict our ability to be in the way that we used to be. And so while grief has always been something that we had to deal with, we had physical supports around us to kind of hold us up, right? In a literal and a figurative sense. And so now with a lot of the state restrictions and the inability to grieve the way that we want to, because to Dr. Al'Uqdah's point, it is life and death, especially if you're immunocompromised. How do we find ourselves? What do we see? So touching that, sometimes when we're grieving, it may not be a physical person that's gone, but it's sometimes even, some people are grieving who they used to be before the pandemic. how they were able to interact, how they were able to connect. I see some head nods, so I want you all to definitely share, please.
I think that, what I would sort of put under the larger umbrella of loss is, for someone like myself, I actually had, until just listening to you, I hadn't really thought of it as grief or loss, but it actually is. I work with more than 30 clients every week, more or less. I see a lot of people, and it is a loss that I cannot see my own clients. I mean, all of us, I think, are in the same boat. We cannot see our clients in person anymore. And, I think that most therapists, there might be some that are okay with, doing everything virtually, but I think most of us, a lot of what we love about our work is that we get to sit and hold space and, and see someone's beautiful smile in person, and feel their energy. And so that is a loss that I hadn't actually articulated, but, for anybody that wonders, how therapists think and feel, we love being with our clients. And so it's hard to not be able to do that except through this screen that, we get used to, but it's not the same at all.
One thing I've noticed is that people have been forced to think about their health. A lot of people like to focus on their work, their school, their children, their friends. When it comes to their health, it's always been on their back burner. But these past couple of months, physical and mental health is kind of like, what does it mean to be a high-risk person? Is that me? I have asthma. So a lot of people are also dealing with, just making those decisions again. Like, I don't know if it's best for me to go into work, these couple of days, or it's best for me to kind of take my child to school. And so just seeing a lot of people discuss, oh, well, I did get diagnosed with this heart condition years ago, but I didn't really, follow up about until now. So just having people talk about health, what public health means to them, and making those decisions as well.
I think I've been struck with this idea of so much of this loss has created this rude awakening. And it's almost been like this tragic, violent birth of things, right? Like that were there, always sort of underneath the surface. We always sort of knew we were going to kind of die, but then it's like in our face, like we had this rude awakening to it, We always kind of knew, like, maybe I have asthma, maybe this is something, but then it was this rude awakening and having this force to look at it, even in terms of like the political climate and the social climate regarding some of these other things. There's been this, because this loss has occurred in such a big fashion, this rude awakening to things has occurred. And it feels like we're sort of scrambling to sort of catch up and put it all together in a manageable piece. And that feeling is sort of overwhelming, that I have these big things coming at me and I need to like break them down to put them in something that is more manageable, something that's less overwhelming. And I feel like that's a lot of what we are struggling with, we inclusive of myself and my clients and my friends and family.
Yeah, I mean, I think the magnitude of grief and loss it's a lot. And I think sometimes it feels easier to manage it in pieces. And so we definitely want to acknowledge that. But I think also just the reminder that even as we're doing this thing called life, that it really is important for us to make space for grief. Because the assumption is that we can do it later or we need to put it aside, but what you don't want it to do to overtake you in a way. So I agree with the notion of just like manageable pieces, especially with everything else that the world is throwing at us in this time. I think that's essential. One of the things that come up is, according to Kubler-Ross, there are different stages of grief. And so some of the stages that they highlight is denial, anger, bargaining, depression, and then the final stage in this particular grief stage is acceptance. How do you find that a grieving person experiences these stages? How do you find that where do you find that people mostly go? Or how do you think people manage these stages? Or do people even use the stages? What are your thoughts?
Well, I don't think that the average person, unless they have a personality that inspires them to do all kinds of reading and research about grief and loss. There are plenty of those people, but I would say the average person isn't thinking about a stage or a phase or anything like that. They're just feeling what they're feeling. In the work that I do, because a lot of the clients I work with are people who have experienced what we would sometimes call traumatic grief or traumatic loss. And so their stories tend to be a bit more intense and in some cases more severe than average, I guess. And so, what I feel I experience with, or I witness with my clients is, Kubler-Ross would describe it as anger. There are other theories, other approaches, of course. William Worden's 4 tasks of mourning. I paraphrase his second task, which basically is about feeling the feelings. So whether it's Kubler-Ross's stage of anger or feeling the feelings, that's where I'd spend a lot of time with my clients. Some in denial or disbelief, some get stuck there, or they make progress and then they end up back there, or, there's a lot of movement between these experiences, for probably anyone. But with my clients, I think I would say a lot of anger and struggling with feeling the feelings.
I would definitely agree with the idea of the anger and the feelings and the movement. I think we sometimes want things to be in stages because we want to reach an end. We want it to be over. We want to grieve and then move past it and go on. But there is this constant sort of ebbing and flowing. There's this constant sort of re-triggering sometimes that may be unexpected, where you feel like you've gotten over the loss of maybe a parent, but then someone calls and you're re-triggered because they're going through a situation that's similar. And so I think that I always tell clients and professionals that, we have to look at our life as if it is a spiral as opposed to a circle. And so we want to really look at our growth over time, our growth over our sort of long-term lens, as opposed to keeping up with the fact that we might be experiencing and feeling the same thing again and again. Because the feelings are going to come and go, because the life cycle sort of continues on and on. So that is something that I would definitely add in terms of thinking about understanding grief and mourning.
Yep.
I like the idea of a spiral, and I think both of your comments are intertwined in that it's a reminder that when you are in it, you feel the feelings. And so it's important that you allow yourself to feel all the feelings, because sometimes it may be anger and sometimes it may be crying, but sometimes it also could be laughter or remembering good times. And so being able, to Ms. Doniger's point and Dr. Al'Uqdah's point, to go through all the feelings and allow yourself to move as you go through, but just experience it. I think there is this assumption that you are supposed to be in this one space, and after 5 months you'll be in this space, and by the time you get to the end of the journey, you have grieved in 1 year. No, grief is an ongoing thing that you may experience throughout your lifetime. It may be 20 years after that loss and you smell something, or you hear a song, or something triggers for you and you're like, oh my goodness. And now you're in the store and you're crying or you're weeping or you're trying to process it, and that's okay too. So just a reminder that grief is natural, right? This is a part of the human experience that none of us can get away from, but a reminder that we are resilient. And I also want to kind of note something else that was said, and put it in the connotation of naming and claiming. So being able to name and claim what it is that you're feeling. So you can have family members who are grieving differently. And it might even be a sibling, right? And you're like, you're grieving, mom, and I'm grieving, but why is it that you allow people to name and claim what it is for them, and don't feel like you need to compare or contrast. Oh, it feels like they're at the end of their grief journey. No, take in all of it. Take in all of it. So thank you for that clarification, because I know a lot of people get stuck in where they feel like they should be, and it makes them feel some guilt around it. So I think I want to transition the conversation to support. And I see a question in the chat. I'm gonna pull that during the Q&A. What are some supports that you all find when someone is experiencing grief? So what are some ways we can support people experiencing grief?
Well, if I may, because I had actually pulled up the chat and I looked and I said, oh, this is something too that I see, right? They're talking about this loss of human connection and how moving to this virtual space has sort of brought up, I'm going to use my own language, but this idea of loneliness, and not being able to sit with that physical energy. And I want people to understand that I think too that might be a stage of grief. I lost my mom during graduate school. I feel like it was a traumatic loss, even though my mom was a survivor of a rare cancer. My mom passed of multiple myeloma. I remember thinking, well, now because my mom has passed, I have to go and build a family. Like I have to go and get married. I have to go and strengthen my community as this sort of repair for having the loss of my mom. Even though I already had a son at that time, like I remembered that thought coming like maybe the day after we buried her. And so I think that when we deal with loss, that is the reverberation, a bounce back of life, of wanting to have life, of wanting to have something to touch, to hold on to connect to, is a part of that grieving process. And so one of the things that we want to do with that feeling, right, is also normalize that. Normalize that when you have lost, whether it is a loved one or sort of the presence of life through physical touch, through physical connection, that you are going to have these bouts of loneliness and feeling alone, right? And then you want to help people understand what are the best ways that they can sort of cope and negotiate that given their current circumstances. And so for me, that looks like helping people to understand the value and the wealth of the connections that they do have, and seeing that as wealthy, right? So instead of, and I, again, in full disclosure, I had to hurry up and go to therapy after I lost my mom too. And one of the things that my therapist really focused in on was helping me understand the value of the life relationships that I had around me and to see it as valuable. So to not necessarily keep so much weight in terms of marriage or in terms of romantic relationships, but all of these other relationships that I had that were valuable and that were fulfilling and that were loving. And so that will look different for our clients. That will look different based on whatever circumstances that they have, but helping them to sort of shift the weight and the value to the present things that they have, as opposed to just the future things that they also are hoping for. That will also come, right? Like, I eventually did get married, and my therapist was like, "Oh, I'm so happy it worked out for you." But the work was learning how to value what I had in that moment and still be patient and hopeful for whatever else I was seeking in my future as well.
So one of the things that she mentioned, and thank you, Dr. Al'Uqdah, for your transparency, but one of the things that she mentioned was her doing her own work, right? And so when we're talking about ways to support people who are experiencing grief as clinicians, obviously our first go-to is that you connect with services and connect with a clinician that can support you through your grief. It's important to highlight that you don't have to go through this alone, right? There are people that are here to help you do this work, whether they are specifically grief and trauma informed clinicians or whether they are just clinicians that deal with a myriad of things. You don't have to journey through this grief by yourself. So what are some ways that people can connect with services? What have you found to be, so if I was a friend of someone who was experiencing grief, how do I support them? And how do I help that person get the support that they need? Any thoughts?
I would say it's always going to be important to learn from the person who they already feel, or if there are people that they already feel they can share with and confide in. Sometimes what happens is the person will say there isn't really anybody that they feel comfortable or safe speaking to, or they thought they could speak to so-and-so, but so-and-so pissed them off because they said some stupid thing, and now, they don't really want to deal with that person. And so I think, assessing who they do, sort of to your point, Dr. Fluid, it was Dr. I can't say it. I'm going to practice though. Anyway, I think to both of your points, you do want to help people to celebrate what they already have, the people that they can sit with, or, who will listen. But also, one of our sort of mottos at the Went Center, where I work part-time, William Went himself, I believe, said this, which is that no one should grieve alone. No one should grieve alone. And so it doesn't have to be your closest friends. It doesn't have to be your mom, dad, cousins, brothers. It can be total strangers. And that's really, I think, why support groups in general, and probably especially peer-led support groups for people who are grieving, are extremely powerful. And that's something that I advocate and promote all the time. Just the other night, a client said to me, I was in this group and, everybody they just understood. And they just got it because they were all there for pretty much the same reason. Somebody important had died, and that's what brought them together. So yeah, I think it's really important to remember, especially with grief, probably with trauma as well. We don't need to do these things alone. We probably shouldn't do we shouldn't go through these experiences alone.
I would also add, and also trying to comment to the person in the chat, that what we also want to be aware of as people who are helpers is that it's not our job to be fixers. And a lot of times when we have friends or families or clients even who are experiencing grief, we think it's our duty to fix it. And the reality is the grief process, it's not going to just be fixable. They're going to be angry sometimes. They're going to be depressed sometimes. They're going to be disgruntled and irritable and anxious and overwhelmed. And so we have to understand that the help is being there. The help is being there without judgment. The help is being there consistently and to say, I'm just checking on you. How you doing? The help is to say, hey, you ran across my mind. I was wondering about you. Let me know if you want to talk. Let me know if you need anything. The help is sending things that you think that they might need, even if they haven't asked. Because sometimes we sort of get angry about that. Well, I would have did it if you asked, but it's the asking might take a lot of work when you're in grieving. So you just sometimes have to say, well, you know what? I like flowers, so let me just send her some flowers. I don't know if she wants flowers, but I'm just gonna send them because I like them. And that's my friend. So I'm gonna try to do what I can do in whatever space that I can because that is of help. And then when they're able to talk to me and give me some guidance as to what help really looks like for them, I will try to do what falls into my bounds as being able to do. But really, all my friends said, just be there, just call, just check on me, and just ask me how I'm doing. And so that we have to be comfortable with that. And again, not focus on fixing it and making it right.
Yes, and add to that point, I've had people vent to me their frustrations with, I'm high risk. I live with my parents. People are trying to force me to go on picnics. People are trying to force me to do this or that. And everyone's not in that same stage of grief yet, where some people are still like, I can't get on the plane, I can't go to work. And so a lot of people are being frustrated, like, well, I need you, but we have to kind of meet people where they are at the time and support people in different ways, whether it looks different than you, whether it's just sending a gift, doing FaceTime. People's like, oh, I hate FaceTime. It's like, yes, you might hate FaceTime, but if your friend doesn't feel comfortable leaving their house, that might be, something you can compromise on. So just be careful with how you do try to support people and try to force them into things they might not be ready for.
And acknowledging the two comments, there's a question I'm going to put it to the chat, to the panelists in a little bit, but acknowledging the two comments, the difficulty that many face that don't know how to help when they're struggling too. So I think that's what they're talking about, right? So when you are also in the process of grieving, there is always this, people also need a support from you to help them grieve. And that can also be overwhelming. And someone said, I struggle with that grief. And I'm assuming it's the grief of helping others, but I would allow that person to add on if they need to, and with everything else, quite to be honest. And so realizing that, going back to what we said earlier, we're in a pandemic. You know what I mean? I know the sun is shining and social media, people may be traveling, people may be doing different things, but it doesn't affect the fact that we're still very much in a pandemic that has shifted and rocked our world for 7.5 months. And so in the midst of this pandemic and all of the other things that are coming up through the pandemic, you're now having to grieve for those who may be grieving for the first time or continual grieving for those who've been grieving for a while. So really just extending yourself grace. Grace and understanding is going to be essential during this period, because the person that you used to be, who may have been able to handle everything pre-pandemic, is not necessarily the same person. So so Benjamin clarified his comment. So yes, in regards to being a fixer. So his grief around having to grieve, but also help others or fix everyone else. And he noted that he lost his father in the beginning of COVID. And he's finding that he needs help because he's always been the helper. So I think that ties back to the question that was asked earlier. And someone was saying that as clinicians, how do we prevent secondary trauma for ourselves? So as we're supporting other people, how do we keep ourselves together? And the responses will be varying, but what are your thoughts about that? Yeah.
So I'll jump in real quick, and I will say that some of the work that I have had to do and the work that I've continued to do is to shift how I see myself as a helper and to understand that I'm not a martyr, right? Like, I'm not doing this just to be completely giving. I receive when I help. That is the way that actually refills my cup, right? And so once I began to understand that being a helper is something that is actually helping to me, then I was able to balance when was I doing it of service to myself and others, and when was it becoming a disservice to me and to others. And I couldn't do that if I just looked at it as, well, I have to be a helper because other people can't help themselves, or I have to do it because nobody else is going to do it. But when I began to see it as, no, this is actually my charity and my gift and the way that I refill my own cup, I was able to create a more healthy boundary with being of help, to be of service to myself and others. And then when I was being of disservice, and then I was able to say no appropriately. And I was able to also list out the things that were helpful to me and fulfilling to me, and engage in those activities in addition to being of a help to others.
I like the way that you said that, not being a martyr, right? So because you're a helper doesn't take away the humanness of yourself, right? So you're still human. So when you're experiencing grief or loss or anything else that you're dealing with in the midst of it, it doesn't, I know you want to help and fix, but we also need to be mindful of how much we take on in the process. And so even though you were the helper prior to, and now you're in the same boat as the people that need your help, these are the times that we need to reach out for services and to connect with mental health clinicians that can support us separately, right? So you can get the support that you need, and someone else can get the support that they need. It doesn't mean that you can still talk about it and still, have conversations around it, but it allows them to have their own individual outlet to process what's happening for them without you feeling like you have to take ownership of that. That's a lot to take on.
And just that other piece of receiving that, doing that is also of help to me. Like when Ms. Doniger said, we get something as clinicians when we're in the room with our clients. We get that feeling, and not just seeing as I'm just pouring out, but that this helping and being of help to others is also something that pours into me. And then being able to say, well, when is it too much? And when do I need to engage in other things that are a help to me as well?
I will say that something I've been very aware of, but also very intentional of during the pandemic, is that I have been really trying to hold myself accountable as much as possible to model what I'm suggesting that my clients do. So if I'm saying to my clients, you've got to get outside and get fresh air, you've got to move your body, you've got to get good sleep, or to the extent that you can do those things, I want to encourage you to do that. If I'm not doing that, then that's sort of ridiculous, and so I have found that I'm much more motivated to be extremely transparent about how I'm taking care of myself, because I'm hoping that we can all be doing maybe not exactly the same thing, but similar. I call it the basics. Take care of the basics: the sleep, the healthy food, the physical activity, and social connection. But it's hard. It's hard for all of us, right?
And I think that's important to know. I think it's important to know the importance of taking care of oneself, especially for those who may be on a call that are clinicians, the importance of self-care, because we do a good job telling this to others, but we don't always do a good job of taking it in. And then when we think about this notion of how we can support people, I think it's important for us to transition the conversation is, what do we think are some resources that could be beneficial for someone experiencing grief? So we have people on a call that are experiencing grief. People have shared in different ways the grief that they're experiencing. So what are some resources that could be beneficial for them? What do we think? Anything that we think could be beneficial?
Well, it's very person to person, it's very case by case. It's, what helps one person would potentially totally turn off somebody else. But I would say that where I tend to start with people, so not necessarily clients, but just anybody, is I try to find out, what already is going on, what kind of support do you already have, whether it's in your family group or your friends group, your coworkers, whatever, what's already there that's helping. And, because of what I do, by the time somebody finds me, they've already figured out all that wasn't enough. They might have a good social support network, but because of what they're going through, they needed something more. We know at the One Center, and anyone who does grief and loss work knows that most people don't seek a grief counselor. And that, I think, is partly because many people have the support that they need, or they may have the support within themselves, the resources within themselves. And unfortunately, I think it's also because many people, there's stigma, there's, things that get in the way for some people who probably would benefit. But I think, really just assessing, what does help you? If it's not feeling enough, then let's talk about whether it's individual therapy, whether it's a support group, whether it's activities that somehow bring you together with others around grief, but maybe it's not specifically a grief group. It could be a sewing group, a knitting group, a dance class.
And so I definitely agree with thinking through the supports and adding additional supports. I would also add slightly shifting, right? Like just a slight shift. Sometimes we make the loss a total loss, right? Like they're completely gone. And we want to feel like then that means they never existed because they're not here in the physical space. And so I will say that sometimes it's helpful for clients to be able to realize that the relationship with the loved one can still exist, but how that relationship looks is now transformed. And so now we will be honoring memories. We will be honoring legacies. We will be talking to you in a way where I won't hear you through my ear, but I might hear you through my spirit and my heart. I might, and so we sort of have to work on that shift of transforming what the relationship looks like, and ways that we can still keep the relationship despite the fact that the person is no longer physically here. And so I encourage clients to continue to talk about their feelings. I think that there's a lot of healing when we don't just hold on to things and not speak to them. So I definitely encourage them to talk about their feelings, to journal as their feelings come up, to think about ways that they can engage in some type of ritualized mourning. So you see a lot in African American communities where, people may honor the loss of their loved one through some type of memorialization of getting names tattooed, or even creating memorial scholarships, or having memorial dinners and anniversaries that still keep the person's memory and honor sort of alive. So I talk to clients about ways that they may be willing to do that. I tell the client that it's okay for them to still talk about the person. A lot of times, they don't want to feel comfortable in even mentioning the relationship or bringing up the memories because that might be hurtful to them initially. But as they do more of that, they're able to sort of, the sad aspect sort of decreases a little bit, and they're able to sort of laugh like, oh, mommy used to do this, or dad used to do this. So I encourage them to continue to talk about them with people that knew their parent. And then I also encourage them to continue in community, right? Like there is, I believe that community means something and we need community. And so to commune with the people that knew the loved one is also a way that helps with the grieving process, right? To talk to maybe your grandmother or grandparents that knew, you know, your parent or whomever, is a way to still is helpful and allows for their memory and their legacy to keep living in you and around you also.
And I think that ties to what we discussed earlier, right? In that there are so many restrictions and ways in which we used to be able to gather and celebrate, but it doesn't preclude us from finding new ways, like Dr. Al'Uqdah mentioned earlier, to celebrate. And so some of the things that we've been able to put in to existence may stay here post-pandemic, right? We may still jump on a Zoom call to do a memorial because even though there may not be a pandemic out there anymore, it may be still too far for someone to drive down or come down. Or we may have a virtual option available so that people can still be a part of the space. So understanding that even though the physical loss of the person may not be here, being able to take in the full experience of who they were and are still and the impact that they have on your life, right? And so I think that's really, really important. And there's a lot of people chatting and communicating in the chat, and I wanted to keep encouraging you to do so. I want to think about if a person feels like they're ready to connect with services, how best do you think that they can do that? How best can a person connect with mental health services? Someone mentioned in the chat that mental health awareness is key. I definitely agree with that. It is essential. There is and still has been a lot of stigma around mental health, but I always say, you know, if I break my foot, I'm going to go to a foot doctor, right? And so there are people that are trained to do this work. And so it's important for you to reach out for those services. So now I feel like I'm ready to talk to someone. How do I, from my home, from my state, because people are joining from all over, how do I connect with services?
Well, you know, I think this present moment is in many ways a good time to connect with services because, you know, many people who might not have reached out to a therapist before are doing so. And I believe it is because in a way it takes less effort to connect with somebody and then from the comfort of your home, you know, meet with them virtually. But, you know, I mean, I think that connecting with services is not necessarily that difficult or complicated. You know, I mean, one can pick up the phone, one can look at various, you know, therapist directories, whether it's Psychology Today, whether it's Black Therapist Rock, Therapist Directory. You know, it's not that hard to reach out. The challenge, I think sometimes, well, probably more often than not, is finding someone who's available, who is a good fit. And I think that things are improving in that way. I think things are definitely improving in terms of access to therapists of color, certainly in the DMV, as well as other parts of the country, Atlanta, Philadelphia, New York, Los Angeles. Those are cities that I deal with, I guess, or, you know, where I have friends and colleagues. But, you know, so I don't think it's necessarily that hard to do the reaching out, but connecting with someone who has training that's probably going to be most beneficial to you and that's going to be a good fit, then you want to sort of go down specific paths. So, you know, whether it's, I mean, you know, obviously it could be any of the three of us, but we're not the only therapists in this town. You know, I think there are ways to specifically seek out grief therapists and counselors as opposed to looking at therapists, you know, who are more generalists, because you don't want to look at like 2,000 names of people, because there are, I'm sure, more than 2,000 therapists in the DMV, right? It's a waste of time. You know, Dr. Fluid, I actually think something that would be great if maybe us on the panel, as well as you, could do would be to really create a comprehensive list specifically for the DMV of you know, potentially therapists of color who not just have an interest, but who are actually doing grief and loss work, because all of you know there's a difference. And I think people deserve, you know, to be able to access sort of that intersection. You know, if you want a therapist of color and you really would benefit from somebody who knows, who sits with people who are grieving, you know, what does that list look like? I'd love to be able to, you know, send that all over town. And I think it's doable. I think it just would take a little bit of time and effort.
Definitely. I put in the chat some of the links that she mentioned. Also, Dr. Al'Uqdah has put her information in the chat. Ms. Doniger will do the same. Dr. Sanders, I saw that you wanted to say something, so I wanted to give you the space.
Yeah, and like kind of similar to Ms. Doniger's point, like a lot of people ask me, well, what's the difference between a psychiatrist and a psychologist, or what's the LPC, what's the MA? So it's like, if you do have friends who can help you out with that, or if you have, you know, an insurance company, they should be able to help you out with that. Like, don't be afraid to ask those questions, because that will help you narrow down your search, as we were talking about earlier. And I think all of those things do matter. You know, and it is hard for people who are just trying to seek treatment. And I think, you know, it would be good to kind of have some sort of information where it's like, okay, do you need a psychiatrist? Do you need a therapist? You know, what are we looking for? And don't be afraid of group therapy or process groups. I know I was kind of hesitant at first, but after the Breonna Taylor decision, I realized, okay, I think I might want to do this. And my friend's clinic was holding a monthly group for Black women. I found that to be very cathartic. So I can put that in the chat as well. And so, you know, don't be afraid to go outside of your comfort zone. Like, for example, I know some people, it's like, well, I'm not really familiar with lighting candles for my ancestors because I grew up in Christian faith, and some people are scared to do things, but turns out, you know, it might be something that might be valuable to you when you do lose, you know, your loved one. So don't be afraid to go outside of your comfort zone.
I think the comfort zone piece is important, right? So there are ways in which we coped prior to the pandemic that will help us even in the midst of the pandemic. So being able to connect with that also, but also getting, like I would like to say, some new tools for your toolbox that can be beneficial also. Dr. Al'Uqdah?
So I would just add, you know, the resources regarding therapy, yes, great. And then Dr. Sanders did mention this other piece, and I just want to elaborate on that. Definitely call your insurance if you have insurance. Yeah. They are paid to help you. They are paid to give you resources and to give you and to do some of the legwork for you. So if you have insurance, definitely call on them because you're paying them already to do that. The second thing, a lot of times we don't want to engage in psychoeducation. So there are some books, a lot of books regarding grief and loss that may be helpful to help you sort of normalize what you may be experiencing. That might be an option. And then some of the other things that Ms. Doniger spoke about earlier that we just know are helpful in terms of wellness, right? We know that eating well, exercising, getting enough sleep, being able to say no when we are drained or taxed, being able to know when we need to rest. Those are just basic sort of ingredients that we know are helpful in terms of wellness. And so you want to make sure that you're engaging in those habits as well. And then I always tell people to listen to the people who you have around you. we are all friends to someone, and we have said to someone, you might want to go to therapy. You might want to talk to somebody else about this. And so one of the ways that you can help yourself is to listen to the people that you already have around you. If people have suggested that therapy is an option for you, or that therapy should be on the table for you, you want to receive that as a help and as a word of advice to help you, and not as a judgment, not as an assault against your character, but as an olive branch and as a help. And so I just wanted to offer those things as well.
Just wanted to read a couple of things from the chat in terms of additional links: therapyforblackmen.org, therapyforblackgirls.com. Someone was Rasha, Miss Portis, or I assume Rasha Portis, noted when Dr. Al'Uqdah was speaking about definitely connecting with your employee EAP benefits, and some may have free therapy sessions. Earlier, Felicia Inachi noted the importance of mindfulness. So even as Dr. Al'Uqdah was listing out the things that we can do for wellness, right? The eating right, the exercise, people had noted the mindfulness. So I wanted to note that. Some other things, especially in a time of pandemic, is watching how much our news consumption. So really just being mindful that that also impacts our mental health. So social media, but especially news that may be true or not true, just a lot of information. We want you to try to reduce that in order to protect your mental health. No is going to be a powerful word in this season. I know we haven't had the chance to talk about that because we are talking about grief and loss, but it's going to be really important for you to establish boundaries in this season, because we're already overwhelmed. And so if you're like constantly being open to every and anything, that will also impact you. Someone talked about the importance of sitting with someone who understands the cultural perspective. So even with, we want you, it's a reminder, I think, for me, that you view mental health clinicians as you would view any other doctor, right? And I know Dr. Saunders was saying the difference between psychologists, psychiatrists, and all those things, but any other person that's providing a service to you, in that, if you go to a primary care doctor and you don't feel like they're treating you right, you don't feel like they're asking you the right questions, you don't feel like you're getting what you need, your next go-to would be to try another primary care. And it would be the same way with mental health. So you may go to someone who you hope will be a good fit for you, but you will find that it may not be a good fit. Don't just throw the whole mental health process away. Try someone else, and just really being open to finding what works best for you. So I asked people, oh, thank you for the book recommendation, things I wish I knew of before my mother died. And anyone else can feel free to type in things in the chat. So I asked for questions because we're in the Q&A portion. We want to transition there for the next 5 to 7 minutes. What do you tell someone who believes that prayer alone will solve their problems? So any thoughts?
I'm assuming these are our friends, because the clients, they've already prayed and come to us too. So, even though we are psychologists, I'm a psychologist, I still have friends and family that's like, no, I got God, so I don't need that. Therapy doesn't work. And I see it as a sort of stage of change. So I'm just in the educational stage. And I just allow them to learn more about what I do as a therapist, what my role is, and how therapy works. And so that's the way that I engage with them. They are just in the stage of change where therapy isn't an option. And so my work right there is just to continue to empathetically educate them. And I have found that has been helpful. If I don't discredit God, I don't discredit prayer or their faith. Just educate them a little bit more about therapy and therapy service and mental health professionals.
I know what has been helpful for me is just for anyone who's like hesitant to do therapy, I had to kind of do some modeling, and be like, I'm in therapy, and people's like, oh, you're in therapy? It's people kind of have a disconnect, like, oh, like therapists don't need to be in therapy. So kind of normalizing, a lot more people are in therapy than you think, and then some people might slowly start to ask questions and then eventually might start seeking out But I do agree it's like a stage of change where some people might start looking and then get discouraged, and it's kind of like a back and forth for some people. So just support them pretty much where they are and keep providing education.
And the goal, I think, is really not to take away someone's coping mechanism, but just example, like I said earlier about the toolbox, but adding to, right? And so if it is essential for them to pray, because that is a way in which they cope, the goal is not to remove that from them, but to explicitly explain to them or empathetically say to them, you can pray as well as seeing someone or talking to someone about what you're going through, right? And so being able to hold both and not or, right? They don't have to choose prayer over therapy. They can hold both. And there are clinicians that may be religious based. So they may be Christian counselors, Muslim counselors, you know, and people that see them and it's connected to their religiosity. That also exists, you know.
I just wanted to add that too, because I think that when we hear, a part of our advocacy as mental health professionals is to always be connected to the people that we want to serve. And so when we hear these stereotypes, people saying, well, I pray, then that tells us that maybe we as a profession aren't reaching enough into the pews where our people are, and how we might want to do workshops in the church as not Dr. So-and-so, but Sister Shareefah. Sister Shareefah is coming to you to talk about mental health. And then because they know me already in this community, then they're like, oh, you are amongst us. And so it's not this foreign thing. And so I always think that when I hear that, that to me says, we're not doing enough work in community outreach and community engagement where they feel like we are separate than them as opposed to amongst them.
And I agree with that. And the only reason that they resonated with me because in the church, we know who the other doctors are. If somebody was to have a panic attack, not even a panic attack, I'm sorry, if something was heart palpitation or someone was not breathing, or we know where the nurses are, we know who the other helpers are, right? So really, like Dr. Al'Uqdah said, infiltrating our communities so they know that we are a helper within the community. This is just the branch or the space in which we occupy. And when you need services, you can pull on that. So someone said, yes, agreed. This is something they're doing in their own church and it's helpful. So being able to branch community in the discussion. I want to know two comments in the chat. I've noticed that this idea, and I'm guessing it's what I was speaking about earlier in terms of religiosity and therapy, the question they brought in. I've noticed that this idea emerges from people who are fearful as being labeled as sinners, okay? And sometimes a combination of both, which is religiosity as well as therapy, is important depending on the level of pain. So yes, we agree with that. We talk about the importance of both, because we're not trying to take away from someone's toolbox. If this is the way they've been coping for 30 years, even for 3 days, allow them to still hold on to that while connecting with services. I want to give an opportunity for the panelists to put in their information in the chat if they would like to. I do want to put a note. Ms. Doniger is a part-time clinician at the WIN Center, but she reminded me that the WIN Center does have a 6-month wait list right now. So we want to be mindful about that, that if you want to connect with them, it is a wait list. So just note that, but note that as a service in the future. Yes?
I just want to piggyback on what you're saying, Dr. Fluid. I confirmed with our intake coordinator yesterday that yes, there is probably a 5 or 6 month waiting list for people who may fall under, certain categories, but something to know about, and this would really be more for people who are kind of feeling urgent about things. The WIN Center does offer short-term therapy sessions. So I think it's maybe like 3 to 5 sessions. And that is something that people could inquire about. And you can, go to the WIN Center's website or, just put in a call to the intake office or the intake department.
Thank you so much for clarifying. So just to clarify, if you are interested in connecting with the WIN Center, please contact the intake coordinator because they may have some short-term things available for you. So we want you to know that. There are also other ways to connect with services in the chat. So we want to encourage you to do that. If you are a current Bison, as you know, the Howard University Counseling Service is open and has been open throughout the entire pandemic. I put our social media pages online because we are 100% virtual. If you need to reach us as a Howard student, I will also put the phone number and email also, so you know that. I want to give any last calls or 1 minute for any questions, but at this time, so I want to give about a minute. But while I'm waiting for that, thank you, Ms. Doniger. I want to really take the time out to thank the panelists for giving of their time, literally and figuratively, to be able to have this community dialogue because it's essential. Grief is a topic that's really, really, really hard for us and not the easiest thing for us and the easiest way for us to deal and process. And so I just really want to thank Ms. Doniger. I want to thank Dr. Saunders, Dr. Shareefah Al'Uqdah for really just coming into the space and having a very authentic, transparent conversation. I want to thank you all for joining us because Zoom fatigue is real. And so I really want to thank you for taking the time to join us. Thank you. Dr. Michael Barnes is the director of the University Counseling Service. He's in the space. He's always really good about being present. And so thank you all. And any other clinicians at the University Counseling Service, thank you for joining us. Thank you, Ms. Jarvis, for being the administrator on this call. Any last thoughts from our panelists?
I would say thank you, Dr. Fluitt, for reaching out to all of us and bringing together what for me has been just a pleasure and a treat to work with all these wonderful, super smart, interesting women. Thank you.
I'd like to thank you as well as a postdoc associate. I really appreciate having this opportunity to speak with the community and also with my fellow clinicians. I appreciate you all. Thank you.
Thank you.
I definitely want to thank you. It is always such a full circle moment to be invited by Dr. Fluitt to do anything, who was my dissertation advisee, and then to have Dr. Barnes, who was my supervisor when I was a student, who is now at the Howard Counseling Service Center. So it's really just a full circle moment and just really always inspiring and enlightening to continue to go through life and to see life continuing on and how we are all growing and reaching new heights and new levels. So I thank you all for allowing me to participate and allowing me to share these moments with you all.
Thank you all so much. My heart is so full. I mean, that's really, anyone who knows me knows this is passion. This is the work that we do, and we have a lot of work to do. And so I really just am grateful for this space. A reminder to HU students, next week we will be holding a space for process for elections. So please stay tuned on our social media pages for that. Really want to encourage all of you all to be well, to be safe. I really just appreciate you all being in here, and anyone that needs to reach the University Counseling Service, I will put the outreach email in the chat. So if you can just bear with me 1 second as I do that. But we want to thank you, thank you, thank you, thank you, thank you. I can't say enough thank yous. Please follow our social media pages for any other community discussions that we have in the future. And with that, be safe and be well. Thank you.
Thank you.
Thank you. Thank you.